exciting guest on our Why Didn't I Know That podcast about empowering women through education and conversation and communication. So with me today is Dr Donna Tanchev, and she is the primary GP and founder of an incredible new medical facility on the Gold Coast called Her Medical.
Yeah.
Welcome and thank you.
Thank you
for having a chat. So my first question would be, how do you leap from completing a medical degree and jumping into going, oh, I know what I'm going to do, I'm going to build a medical practice? How did that happen?
That was always my kind of intention from going into medical school.
Yeah.
I liked general practice. I liked my own GP. I'm from Newcastle, and then I moved up to the Gold Coast for uni.
Yeah.
And just didn't find a place that I, as a young woman, wanted to go to, where it looked nice, it felt nice. I didn't want to be sitting, in just the typical medical centre that's
cold and sterile.
Is really not conducive to women's health at all.
Yes, very true.
And so I always had the vision of beautiful, pink, nice, pretty, walk in, feel like a salon, feel like a spa.
There's music playing.
Exactly.
Yeah.
It's nice place to work, nice place to visit.
Good for your blood pressure.
Good for your blood pressure. Visually appealing, and you're comfortable, because it's stressful going in the first place.
Absolutely.
So
because most people have something wrong with them, so they're under stress anyway, aren't they?
And it's just, that's where it came from. I wanted...
Out of personal frustration.
Yes. Yep, totally.
Yeah,
totally.
So you filled a gap in the market.
Absolutely.
And so is your main clientele female, women?
Yes, women. Well, the focus was women, but everyone around the woman as well. So children, partners, because I think a lot of that is driven by the woman.
Of course.
The wife sends the husband, sends her partner in, brings the kids in, does the child immunizations.
Yes.
So I think, the woman is the central aspect.
Absolutely.
And then
they run the home, don't
exactly.
they?
I think so.
And do men feel just as comfortable here, surrounded by kids? Do they get in touch with their feminine side?
Some of them really like it. Some of them are a little bit like, am I allowed in here?
Yes,
but we've got great GPs, really experienced in women's and men's health. And so we want to encourage men, to come along and also get in touch with their health, up to date with all their health checks as well.
Yes.
Which I feel like doesn't really happen.
They can be a bit neglectful of themselves.
And you're always like, oh, well, my wife booked this appointment, or my wife pushed me to come in and get my bloods done. And so that's kind of what we try to do.
And do you have a variety of practitioners here who specialise in different things?
Yes, so we have, each of us are all general practitioners,
right? And
then we've all got kind of our own interest areas. So we've got someone who enjoys really kids and child's health, cosmetic sort of stuff. We've got skin doctor. We've got someone that does cannabis, CBD prescribing, that type of stuff, just to try and cover all the different areas and problems that women need, and tackle problems with more than one, approach.
Sure. So it's really an integrative practice.
Yeah, definitely.
Yeah.
And if one thing's not working, then we've got doctors within the one practice who can kind of maybe take this approach or that approach and combine medications as well as other non-medical stuff to try and solve the problem.
Yeah. Do you find, is diet and lifestyle something that gets discussed in any of your consults?
Always. It has to be always first line. It has to be diet and exercise. You've got so many prominent doctors now, like Michael Mosley.
Yes, I love his programs.
Other doctors in the UK, Tim Spector, I don't know if you know of him, but massive focus on diet and what you're taking in and how that's affecting everything from mindset, gut health. Gut health is huge now.
Yeah, one of my favourite topics, gut health. And I suppose the connection that people need to understand how that contributes to their longevity of life and their quality of life. I mean, we all want to be here for a long time, but we want to be the best we can be for the time we're here as well. Yep,
absolutely. Yeah. I think gut health is super important. The mind-gut connection, the whole axis is so important. So anything, I think, treatment-wise really has to start from diet and lifestyle, and then the cascade goes down to all the different kind of things you can add in.
Yes.
But I think if your diet and lifestyle isn't correct, then there's really minimal effect that medications are going to do in the long term.
Sure. Do you think that when that advice comes from a GP, that you know where I'm going, because from the natural aspect of as a naturopath, I talk about diet, lifestyle, gut health all the time. But do people take more notice when it comes from a doctor? Is it a hard thing for people to understand that is so important?
I think that just oversaturation of the same message. And a lot of the time people have tried to focus on diet and lifestyle and, done the right thing and do the calorie restriction and don't eat this and eat that. And I think there's just too much information on social media, on the TV, in magazines, this diet, that diet.
And extreme in some cases.
Eat this, don't eat that. And it's just overwhelming.
Yes.
It can be really hard. And then there's other factors like menopause or other medical conditions that even if you do diet perfectly and exercise 5 days a week, it's really hard.
Yes.
And sometimes you do need a little bit of help.
Yeah, absolutely. I think, we have made it more complicated in our lives. Diet and lifestyle has become really complicated, whereas if we just went back to something as simple as maybe meat and 3 veg.
Something,
Just go back to the basics of what grandma used to make.
So I think by the time they've come to see us, I think they're just sick of hearing diet and lifestyle, and they've already explored a lot of that before they come to see us. And sometimes me telling them, it's more frustrating than really helpful.
Yeah, exactly. In the world that we live in with Google, how does that affect your patient care? So in one way, Google brings the world to us and we can ask any question we like. We type it in, there's an answer. How does that affect your consultation when someone comes in with 1,000 questions and they've gone to Dr. Google, and they've, Googled what they think is wrong with them, and they have an opinion about their own health?
I don't love Dr. Google because it's just not possible for Google to give you an accurate, appropriate answer for your specific individual situation. Sometimes it is good because maybe you have a symptom that you haven't thought is a big deal, and then Google suggests it might be, so it brings you in.
Yes.
But going to Google with your symptoms is just a recipe for anxiety that probably is unnecessary.
And alarmism, so you might think, I've got a headache, oh my God, I've got a brain tumour, kind of thing.
TikTok now that the younger girls are using.
Interesting.
I saw this on TikTok and it's like,
wow,
such fake news, bad information. TikTok, social media, Instagram, not a good source of information and health education. Go see a professional. Yes.
Absolutely. Go and see someone who has some understanding of health and and what
very important.
Yes, exactly. When it comes to women's health, obviously, I work with a lot of women who are menopausal and hormones. How do you think that conversation is changing in modern times? How is medicine keeping up with the changes and women's approach to hormones and menopause?
Yes. Well, I think menopause has been a taboo topic for a long time. And I think now that Hollywood, like the younger Hollywood generation, like Gwyneth Paltrow, Cameron Diaz, Jennifer Aniston, they're all going through that at the moment, and they're kind of highlighting it, bringing it to the forefront, talking about low libido, talking about vaginal dryness, hot flushes, I feel crazy. That's exactly how you do feel.
Absolutely.
And so I think more of the discussion from people in the media, and it gets other women talking, and then soon as you talk to one other woman in your age group and say, I feel like this, chances are she's going to say she feels the same.
Yeah, that's right.
And so you're not alone. It is a common thing. And in the way kind of people talk about everything else, menopause has to be that exact same conversation.
Yeah, definitely. Was menopause something you discussed with your mother?
Well, my mum was lucky enough not to have any symptoms. So
wow. What was her secret ingredient, secret recipe for that?
Don't know. So she never actually went through it and had any issues. And
was it a lifestyle or cultural thing, do you think?
I think potentially, she just didn't go through it, didn't have any symptoms.
So you're hoping that your
Yes.
DNA and your genetic
Yes.
profile
Yes.
is going to hold you well.
Yes.
Yeah.
But yeah, my grandma, same thing.
Really?
Yeah. So I don't know if it was something in the
Wow.
food or.
Well, it's interesting because you said that you're Macedonian descent.
Yeah.
And I would imagine that, dietary wise, that's quite a healthy lifestyle.
Yeah.
Very in comparison, like, and similar to maybe the
Yes.
Mediterranean
Yeah, I
diet.
was just going to say, yeah.
So
It's the
eating a lot of
Mediterranean.
legumes and vegetables and
Yeah, lean meats, fresh fruit, fresh vegetables, a lot of stuff from the garden,
yeah,
that sort of thing.
just basics, meat and through veg.
Yep, pretty much.
Basically,
Yep.
bringing it back.
Mhm.
Yeah. So do you think, okay, now when it comes to hormones, and we talk about diet and lifestyle, but one of the big things that I talk to women about too, what I see, this rushing women syndrome,
Yeah.
that it's sort of been coined, women are under so much stress.
Yes.
I think, rather than getting better, it seems to be getting worse. There's
yeah.
so much expectation on women these days.
Yeah.
How much impact do you think stress has on a woman's health?
Everything. Stress. I really believe that stress can cause anything and everything. Anything is possibly related to stress. Heart disease, depression, anxiety, worsening menopause, everything, like absolutely everything affects your periods, affects your ability to focus, affects relationships. I mean, and
every part of your life,
yeah,
isn't it?
it raises your stress hormones, which then has constant roll-on effects. So I think first and foremost, you have to put boundaries in place. You really can't just push because you will eventually stop and you'll be forced
Burn
physically
out.
to stop.
Yes, something will manifest
Yeah.
physically that
Yes.
will force you to have to go
Yeah.
and have a break.
You have to stop. And career and children and house and this and that, and it's just too much. At some point you have to say, I need to look after me first, I need to stop, I can't do that today, or
That's right.
Prioritize.
Learn to say no.
Yes, absolutely.
Yeah. Life gets very busy, doesn't it? There's so
Absolutely.
many demands on women.
Mm-hmm.
Yeah, it's a tough space to be in. What do you think the future of healthcare looks like? Since you've built this beautiful medical centre, and it's integrative, it's holistic.
Yes.
In the way that you approach your patient care, it takes the stigma out of like going to those cold spaces that you're not used to sit at to go and see a doctor. Do you think this is a model that will be copied? That
I hope so.
Yeah. Do you have plans for more?
I'm not sure. I'm still trying to get this one perfect, and kind of just making this the best kind of place that it can be, and potentially, if there's a need for it, or if people are liking the space that we've created, then hopefully yes.
Yes.
But I think in terms of where is it headed, I think more of these places will do really well, because that's what women want.
Yes.
You've got the younger group of women who suffer with endometriosis, who go to the GP, I've got painful periods, go on the pill, I don't want to go on the pill, that's it. Or I've got hot flushes, I feel crazy, HRT is bad, just deal with it. And so you walk out and you just deal with it. And I don't think women are accepting that anymore.
No, we don't want to hear that there's nothing wrong with us when we absolutely
when
know that something isn't right.
Exactly.
And to be dismissed. I think that's what you hear a lot of. And I know, with myself and talking to women, especially who are menopausal, who go to GPs, and they'll do a bloods, and they'll, the bloods look fine. They're in but the women are going, but I feel like I'm going mad.
That's right. And so there's always something else that can be done. There's always somewhere else that you can be referred to. There's always something that can be looked into, and I always say to patients, your body better than me or anybody else. So if you don't feel that it's right, then, you keep looking and you keep going until you find a solution.
You find the answers that give you relief and address the problems that you've come in with.
Exactly.
What's the number one, when we talk about menopause with women, what's the number one symptom that women come to you and have a problem with?
I think it's I think it's 3. It's hot flushes,
Yep.
it's not sleeping, and it's weight gain.
Yes.
Weight gain is as common during that menopause period as hot flushes. And feeling crazy.
Yeah,
really
absolutely.
feeling like totally out of control.
Yeah, like it's an out-of-body kind of
yes.
experience. Yeah.
Crying, not crying,
Yes.
irritable, angry, flying off the handle for nothing. Just uncontrollable emotional kind of instability.
And what sort of testing would you normally undertake for women who are coming in?
Generally, you go by clinically the symptoms.
Yes.
You can do blood tests, to confirm what you're thinking, but at the end of the day, you treat the patient in front of you. You don't treat the numbers on the blood test.
Yeah.
And so a lot of people kind of are stuck on check this, check that. But even if that's normal, I have to go by the history that you give me, the presentation that's in front of me. And so I think it's more clinical rather than specific blood tests that you're looking at.
Yeah. And do you do you use a combination of, traditional medicine as well as natural medicine to treat those sort of symptoms?
Yeah, we always go by, what does the woman want? Do you want to use HRT? Do you want to avoid hormones at all costs? Do you prefer natural approach?
Yeah.
And then, we start with one and what's working, what's not working, and move to the next thing. Diet as well, supplements that come in there, stuff that you can add to your food.
Because a lot of women are doing the same thing, like especially with weight gain, nothing's changed in their diet and stuff.
Yes.
But I think what they need to understand too is that their metabolism is slowing down. It doesn't, we're not burning fat the way we used to. And I know that, with my age and going through menopause, it was like, oh, hang on a minute, that wasn't there before. Those little handles were on the side before. And nothing has changed, but it's about, I suppose you have to tweak your health.
Yes. So with menopause, your estrogen levels drop. And with your estrogen levels falling, your lean muscle mass falls. And so does your metabolism. And the less lean muscle mass you have, the less fat you burn at rest.
Right.
So things like resistance training, I think most important for women as they approach menopause and after menopause, not only to maintain muscle mass and help with kind of weight regulation, but also for bone density, preventing osteoporosis, things like that.
So they've got all those great sort of Pilates classes and things now with the resistance bands and all that sort of stuff.
Perfect.
Yeah. Okay. And with regard to HRT, has that come a long way since its early days? Because it obviously had a bad rap for quite some time, and so women can balk at the thought of HRT.
Yes.
Oh, it's all synthetic. But how does that fit into the picture now?
Yeah, HRT had that one big study that wasn't really done well. It wasn't the most representative study. Further studies have since come out, and now also different topical preparations of HRT, which carry lower risk profiles with respect to blood clots and things like that. Don't get metabolized by the liver, so pretty much most women could be eligible for topical HRT, like gels or patches. Estrogen is very beneficial for bone density, for cognition. There's some kind of evidence about protective against bowel cancer. It's the most effective treatment for hot flushes, vaginal dryness, and those troublesome symptoms of menopause. And estrogen alone, say for women who have had a hysterectomy and things like that, there's no issue in terms of increased risk of breast cancer, blood clots. So I encourage it in that particular group of women. And then I guess it's just individual basis based on risk profile. And then it comes down to quality of life. If it's really debilitating.
Absolutely.
I've had women, I don't want to live if I can't go on HRT and feel like a normal person.
So again, it's just really individualised patient care, isn't it?
Yeah, but I think the message is that hormones are not always bad. And there's other risk factors for breast cancer than HRT. Stuff that we do every day, like alcohol, for example. Drinking wine, over a certain amount increases your risk of breast cancer. But when they hear HRT, it's like, Yeah,
interesting, isn't it? Yeah, their lifestyle could be much worse for them.
Correct.
And alcohol's a big one. You know, I've always encouraged people to do Dry July or what is it, Sober October, which we're in at the moment.
Yeah.
So, and just reducing your risks by how you live your life.
Yes.
You know, and we have control over that.
Exactly.
And it does make a difference. I know, you know, even with myself, you know, if you are having an alcoholic drink, most women will tend to wake up in the middle of the night, can't sleep, they're having those hot flushes, you know, their liver's overactive, isn't it, trying to get rid of it, because to their body it's just a poison.
Toxic,
trying to get it out. So big lesson to the ladies that are out there.
Yes.
Okay. All right, so when we're talking about lifestyle and what we can suggest for ladies, what are your top tips? Say 3 top tips that women can do to empower themselves, their health, and live long, healthy, happy lives.
Yep. I think number 1 is just to prioritize yourself first. And it can be really difficult with kids and husbands and work and this and that, but you really have to fill your cup before you can fill anybody else's.
Yes.
The second thing would be don't sweat the small stuff.
Yes.
Stress, it's so easy to get caught up in, you know, your social circle, your things at home, and you know, things seem bigger and more important than they are.
Yes.
But if you can really step back and say, you know,
How
I'm alive,
important is
I'm healthy, you know.
Am I overreacting?
Yes.
Does this really need the attention I'm giving it?
Exactly. And I think have a me day, you know.
Yes.
Really important to schedule that in. Get your nails done, go to the salon, you know, have a massage. Really, that self-care, I think will stand you in good stead.
Yes, I think nurturing ourselves and nurturing what our heart needs.
Yeah.
So, you know, the more we do that for ourselves, the more we have then to give others.
Exactly.
Because, I mean, it is life, you know, I have elderly parents I now look after.
Yes.
I mean, I have grown children. So I have sort of both sides.
Yes,
and
I'm
you know, I'm right in the middle, I'm working and you're trying to balance everything. So it is a really important thing to know how to prioritise your life and to take time out. And I love my alone time. For me, my meditation time, if you want to call it that, is walking on the beach every morning with my dog. You know, that is my time. And in the afternoon we go to the dog park, which is a bit more social. But I actually really love time alone. And I think in the busy world we have, a lot of people don't get time alone.
No, everything just rolls on and goes, go, and then you will stop at some point.
Yeah,
so
absolutely.
You know, 24 hours in the scheme of things isn't going to make a huge difference either way, but it will to you kind of mentally and physically, just to slow down and get back in touch with yourself, center, you know, yourself.
Yeah, you're going to feel happier in yourself.
Yeah.
But you're actually going to be a happier person to be around for others as well.
And radiate that.
Radiate love. Yeah. Go inside to be a better person on the outside.
That's
what I think there's some great tips. Well, if anyone's obviously, if you're on the Gold Coast, you know this building because it's on Bundle Road in Surfers Paradise or just west of Surfers Paradise. And it's not hard to
miss. The big pink building.
Big pink building on the corner, Her Medical, which is fantastic. Well, I wish you all the well. Thank you for spending some time and you know, helping women understand the importance of looking after themselves and making sure they seek professional help.
Yes.
Stop Dr. Googling.
Yes.
Okay. Thanks, Donna. Thanks for your time.
Thank you. Gee, that did go quick.